All right, thank you very much for keeping it locked right here on KBC Channel 1. You're just back in time for just one more thing. It's all about mental health this morning, as I am joined by Dr. Catherine Mutisia. She is a psychiatrist towards my father's left, a psychiatrist, and Samuel Boyo. He is a mental health activist and also one who is also a survivor. Thank you very much for coming and joining me in the studio. Remember the hashtag to use on Twitter at KBC Television, the hashtag Good Morning Kenya, at Ram Aguko, and at Jane Wambui. Now, the World Health Organization had given estimates about 800,000 people who died through suicide every year. What are the signs and symptoms of someone who is not mentally healthy?
If we define what is good mental health, then we can actually be able to tell when somebody is moving away from good mental health towards mental illness. And when you have good mental health, one, you are able to realize your potential, you are able to adjust to stresses which come and in your life, and you are also able to contribute towards the society. So once you discover that you're not able to do that, then you start getting mental health problems, which could affect mood, whether you feel sad or happy, which could affect your behavior. Your behavior changes from what people know you to be, or even thoughts. And thoughts would be picked from the things you say. Maybe you have lost hope, so you talk of hopelessness, you are guilty unnecessarily. Yeah, so those are some of the things we look at to see. Yes.
So it's possible to pick out someone who is not stable or healthy?
Yes.
All right. And we'll talk about the suicide rates even as we continue with this discussion. But Samuel,
yes,
tell us your story.
Okay, me, I'm a mental health survivor, and I suffered from a mental health condition known as bipolar. Is a mental illness that get into you, then it is you get into depression, and sometimes you get, it has a two-way. When you are hyper, you think of things that are out of your control, you become totally out of reality.
And how did you manage to come out of it and to the level that you became an activist?
Okay, after a lot of proper diagnosed and proper medication. That's and also adherence to medication and positive and good coping mechanism. Yes,
diagnosis, medication.
Yeah, and counseling also play a very great.
Counseling also.
Very great part. It play a very great role in my recovery to sanity.
All right.
Yes.
When you talk about counselors and the medication, do we have sufficient manpower in dealing with people who have mental health situations?
We don't have adequate number of professionals, but many primary health care, nurses, clinical officers, doctors, general doctors, even before you go to the specialist, can actually be able to identify and refer. But now we also encourage the members of public to be able to offer mental health first aid and psychological first aid. So the way you would offer physical first aid, every member of the society should actually be able to tell when somebody's mental health is breaking down, and they can actually give first aid and refer for treatment.
How do you give first aid? For example, like you, were you given any first aid?
No. Member of the public does understand more about mental illness. When they even take you as a criminal, they are unaware. They find you are misbehaving, or you are abusing drugs, or you are drunk.
So they separate themselves from you?
Yeah, and what they do, they punish you. Like me, there's a time I could go and pick some things which is not mine. They could meet me and think I was a thief. They never knew that I was suffering from a mental illness.
And how is it that it was discovered that it's a mental illness?
It takes a lot of time to be proper diagnosed well, because at first I could feel I have abdominal pain. I don't want to participate, as the doctor has said. I don't want to participate to enjoy the things that I used to do on a daily basis. Then my parents could think I'm also becoming rebellious. I could lock myself inside the house. Then they never think I have an underlying problem, which is a mental concern.
Is there someone who was able to easily pick it out?
I was just diagnosed properly in Mathare, but when I went to our health center, they could give me a different drug from which they never diagnosed well, meaning they could give me drugs which are not proper.
Do you have cases of misdiagnosis? Someone thinks that maybe this patient is suffering from this, but in the end, they
Yes.
realize it is actually a mental health case.
Yes, we have a lot of misdiagnosis because mental health issues are not well understood by members of public. So you have people who might be accused that it's purely substance use when it's actually a mental illness and the person is not using drugs. Of course, there are cases where it's precipitated by use of a drug or a substance. And in our society, people will spend a lot of time because these are diagnoses of exclusion. So we rule out infections, we rule out tumor, we rule out biochemical changes in your body. And so when the person is told all these tests are negative, then they say, then this must be witchcraft, or it must be spiritual warfare, or it could be anything else, not illness.
Then
So-
how can a common man understand that this case must be mental?
Yeah, and that's why we are saying when you see somebody's behavior change, like this person, like Samuel has said, his parents thought he was being rebellious. So like a child or an adolescent or an adult who was very cooperative, was supportive, and their behavior starts
And
changing.
obedient.
They become rebellious. Then before you dismiss or punish them, it would be good to consult. When a child starts or somebody starts locking themselves, and before they had friends, somebody loved maybe playing with others or going to work or pursuing a hobby, then they change, they are not interested. Those are some of the telltale signs where now when we talk of mental health first aid, it's a bit of just listening to the person, getting to understand without judging them what is happening to them, reassuring them, and very important, linking them up to mental health services for proper diagnosis.
But then how do you deal with someone who has this kind of a case as a psychiatrist?
It depends on what case it is. The emergencies commonly we see would be acute suicidal ideas, like somebody wanting to kill themselves. They could leave a note, they could speak and talk about there's no use of living, I wish I was dead. Suicidal ideations is one of the common emergencies. Panic attack, somebody thinks they have a heart attack, it's also very common. Depression, where somebody withdraws and locks themselves. Of course, substances and drugs, where somebody, like now there's a lot of cannabis-induced psychosis, where somebody smokes something and their behavior suddenly changes. It's also another emergency. So there are all forms of emergencies. The severe illnesses where somebody seems to talk to themselves, like what we call hallucinations, or a manic episode where somebody becomes very happy, talks of big things, could even say they are the president. And so there are all forms of...
I see he's pointing himself.
Yeah.
You want
Yes.
had
he
that
could
kind
share
of
his
an
experience maybe.
Yes, okay. I used to think how I want to become the president. I want to be to Obama. I thought I have a very special, I thought myself very special than anyone else or superpower. I want to associate myself with big people. I have a lot of money in the banks. I have the big position and the best jobs ever in the world.
So there was a way that you wanted to be treated also?
Yes, there's a I was to be treated, and then that is when I was hyper. Then after that, when you see that one is not reality, you tend to contemplate suicide, because now you think now you want to be to Obama, you are so special, people are giving you a lot of attention, and then all of a sudden that is not reality. Now you think no, this is not reality. Now you think of how I can end my life, because the life now you think. You find yourself, when you come to reality, you think everything is depressive.
But not everyone lands in mental hospitals. There are people who have committed suicides. Even recently, we had businessmen, powerful men, who have committed suicide, even within Nairobi County. how is it that someone can be able to get help so that the way that they are, maybe someone is depressed, how can they be able to get help so that they don't go to the point of committing suicide?
We say for us to be able to prevent suicides, we need, one, to have social connectedness, where you are able to check with your loved ones or your friends or your colleagues, whether they are okay. If they don't show up to work, or they miss out in a family function, or they are locking themselves, check out with them and see whether they're okay or not. Then communicate. Like, it looks very simple when we say listening without judgment. It's not easy. Like, you've seen some of the instances of reported suicides, even though they are not confirmed. People will go on social media and say, this person should not have done this, don't be too ambitious, they're already judging that this person, they think they know what caused the turmoil. So listening without being judgmental, without saying you have everything, why are you depressed? You don't lack anything, you're very rich, you have achieved your career. So when you listen to somebody without being judgmental, then you are actually be able to help them and link them up for treatment, because not everybody will be able to give the necessary support. But as long as you can understand them, be there for them, and refer them early enough, because suicidal ideation, and many people who commit suicide have tried to communicate. It might not be obvious, but maybe there's a way they've tried to communicate to somebody somewhere.
There's always a message that is
There's
passed.
always a message somewhere. Sometimes you may need to take somebody to hospital against their wish, because when they are severely ill, they do not understand that they are severely ill.
There are some people who have committed suicide, and even the people who are closest to them could say, we never suspected that they could do this. We never even got any sign. And they would say, some cases where people are so closed up within themselves that they are introverts, that they would hide their emotions, and at the end of the day, they commit suicide. What can be done in such a scenario?
Yeah, and that's why I'm saying, if we can communicate and care for one another, because either your neighbor, or either your colleague at work, or the people you do business with, or your family, or the extended family, can actually be able to see that something is wrong somewhere. Because if you are isolated without social contacts, then those are the cases where you find somebody committed suicide and nobody suspected, because nobody actually interacted with them. So we need to increase our social interaction so that nobody is left out alone. I know as we urbanize, we also break down our social structures. So that's something we need to emphasize on, interact more, care for each other, and so that we can know when somebody is going through problems.
All right. Yes. As we are wrapping things up, because time is not on our side, maybe you can give us the difference between mental health and depression.
Okay. Depression is a mental illness. And so if you are mentally ill, then your mental health is not good.
So depression is a form of mental
illness?
a
mental illness. Okay. Many people think mental illnesses are the severe illnesses, like what we call schizophrenia or bipolar or substance use. But anxieties, excessive fear, very common, can actually make you not perform your work, can make you not take care of your family. Depression, where somebody doesn't feel like working, doesn't feel like eating, doesn't feel like interaction, actually makes you not contribute to the society, and it can actually end up with suicide if it's not treated. So those are very common. Substance use is also becoming very common. So those are mental illnesses which can be treated, and the person moves on and lives a normal life.
Wow. Let me give you a chance here. Yes. You are an activist.
Yes.
What message would you like to pass to the public outside there with regards to mental health?
Okay, the first message is to help those people with mental illness, even the people at home. When you see you have a problem, someone you love has a problem, don't try to judge him or neglect him or leave her or say he is her own. You just try to convince her to see the doctor. Like me, I wish if I was taken to hospital earlier enough, I could recover earlier enough.
No.
Don't hesitate. If you start complaining, the physical, mental illness also start as a physical, it start as a physical. So if you go to the hospital, if you have abdominal pain, you go for thorough examination. And member of the public, when you see people there, they are sick, they are helpless, don't leave them. Just take them to hospital, try to support them, and they recover and they can live a better life. And don't stereotype people, call them wazimu. There is no wazimu. Just don't stigmatize people. Like us people who are mentally ill, we are so much stigmatized. When you go to the public, we go to the supermarket, you go to the bus, they talk about being wazimu. They also tell people, they also stereotype Mathare Hospital. Huku ni kwa wagoroki, ni kwa wazimu. Meaning people see is a hospital which people go there for treatment. It's not a bad place as people think, member of public thinks.
That is Samuel Boyo, a mental health activist and a survivor. And I am joined also by Dr. Catherine Mutisia. She is a psychiatrist. This morning it was all about Health Tuesday, discussing mental health and also discussing cervical cancer this morning. Initially we had the Nyumba Kumi initiative discussion. You can be part of this at KBC Television, on Twitter at Ram Maguko and at Jane Wambui. The hashtag is Good Morning Kenya. According to my watch, it's now 8:57 a.m. It means it's time for us to wrap up the show. Good Morning Kenya takes a break till tomorrow morning. Tune in again. KBC Channel 1 is the best place to be each and every morning. God bless you. Have a blessed day. My name is Ram Aguko.